Welcome to today's demo of Hot Health. Today I'm going to be walking through a little bit about Hot Health in general, but also specifically about the online forms component, which has just newly been released in April 2020. So Hot Health is an online engagement platform that gives organisations the ability to engage online with their patients or clients, whether that be through content distribution, communication, events, notifications, but also things that help to run your clinical practice. So online bookings, the ability for your clients or patients to reschedule appointments, and now the ability to also fill out forms online. So your Hot Health site itself has a unique URL. It's where your patients and end users can go to access your own portal. All of it's branded, so you can decide what your logo is, what colours you have on there, and your content and images as well. You can also specify what is available across the top. So if you were just using this for appointments and forms, you could hide news, events, chat, and locations and staff profiles, and just have your appointments there, and also any forms that you need available. So I'm just going to jump into the back end of the dashboard, which is where we set up the forms component. So this dashboard is accessible by managers and assistant managers of the site. If you want someone to be able to edit forms and see form submissions, then they need to have manager access. So the first thing that we need to do is, if you have a ReferralNet or Argus account and you want your completed form to be sent via secure message to your practice management system, so you actually don't need to go into Hot Health and download the form or save it, the way we set that endpoint is we go into organisation details and we enter in the ReferralNet recipient ID. This could be ReferralNet, it could also be Argus. If you don't know your ID, you can do a lookup of it that looks up matches of the site, and you can select that. Otherwise, you can find out your ReferralNet ID through ReferralNet or also through whatever practice management system you're using, depending on if that feature is available for them. So once you've selected the ReferralNet ID that you want forms to be sent to, we just click Save and we go back to your dashboard. Now, all your forms are right down here on the left. And in here, we can see all the forms we have set up, how many total submissions there have been for that form, and also how many forms have been submitted in the current billing period. The reason that this is here is because Hot Health works off a usage basis. So you pay a baseline subscription, which might be $6 a month, and then you pay for the number of forms that you use in a month, so that it's quite accessible for small to large organisations. So when we create a new form, we click on New, and you can choose to start from a template that we have predefined. So it might be a good idea to start from one and you can edit from there. Otherwise, if you want to start from a completely blank template or canvas, you can just click Start from Blank. We're going to pick the influenza screening form as we're coming up to winter. So Start New Form. So you enter in the name of the form. This will be visible to the end user as well. You can enter in an email address that you want to be notified on the submission of this form. You can also choose to leave that blank if you don't want to receive an email every time a form has been submitted. And here we can select whether you want that form to be sent to your secure messaging provider. So we're going to leave that on yes. If you were using this form for something like patient satisfaction or event RSVPs or something non-clinical related, you could untick that so that you can just do an export CSV at the end to look at the results. But in the purpose of clinical forms or patient data forms, we probably do want that to be on to send it to ReferralNet. So here I can see that the form template is already laid out based on me selecting the influenza screening form previously, but we can add extra fields if we want by dragging and dropping that in. Or we can edit existing fields by clicking on the edit button. So if you want something to be sent via ReferralNet, we do need to have the first name, the last name, and the date of birth entered in. If you have this ticked and you don't have those entered in, you'll get a warning message to tell you that you haven't set it up correctly. So once you're happy with the form itself, you can create the form, but you can also enter in any notification rules. So if you want an email address to be notified when someone does have some of these symptoms, you can enter that in here. So when field name, are you suffering from the following symptoms, equals any of these, then we're going to notify an email address that you input. We go create form. So once we've created the form, this is where you can come to see results and also get your URL that you need to send people. So once you've created a form, it doesn't automatically appear in your menu bar. It just appears on a link here. So you can either add this to a custom page on your Hot Health site. You could add this link to, if you were already using an existing website, you could just add this URL to your existing website, or you might choose to put this URL in an SMS message or an email message where you send that out to people who have booked an appointment. There's a few different ways you can use that URL, but that URL is the one where people can actually view the end form, which I'll show you in a bit. So there's no submissions of this form. So if I go back to all my other forms and go to one that does have submissions, so we'll go to new patient registration. Down the bottom here, I can see all the forms that have been submitted. I can see if the user was logged into their Hot Health account, I can see what user it is. And then I can see when the form data was last viewed and by what staff member it was viewed by. So these ones in grey haven't been viewed yet. If this form has been sent, that it will be sent to ReferralNet, all of these forms will also be sent to your ReferralNet account as well. But if you are in